February is National Children's Dental Health Month, so we're going to tackle some of the most frequently asked questions regarding children's oral hygiene. And Lindsay Bermudez is the founder of babycito, and Dr. Monami Gatek is with Merrifield Pediatric Dentistry. Thank you so much for being here.
Yeah, thank you for having us.
So first off, let's speak to just the differing roles that both of you guys have and how you work together.
Absolutely, yeah. So I'm the founder of babycito, which is sort of like an Angie's List for parents and families in Northern Virginia to connect with trusted and screened local providers. And Dr. Gatek is one of our amazing local pediatric dental providers, and we're happy to be here with her.
Okay, so how do you guys on a day-to-day basis, or how does it work?
So Dr. Gatek is listed on our free provider directory. All our providers we screen and check references for, so families can find her information there and connect with her. And then also we have community events and different opportunities for families to connect with providers like Dr. Gatek.
All right. So obviously in light of this month, what are some of the most common concerns that you hear from parents when they're, dealing with their little ones and different like oral hygiene questions?
So we get a lot of questions from new parents. Big ones are how to prevent cavities, or when do my child's first teeth show up, or when do my child's first teeth fall off. Those are the big ones.
Okay. What are some of the answers? Because those are all questions I have.
So first teeth usually show up at around age 6 months.
Yep.
And first teeth to fall off usually fall off at around age 6 years. Mm-hmm. And then first visit to the dentist, that's another one we get asked. And that's usually at around age 1. Unless there are any other issues, yes.
Okay, because I feel like I tried to do this when I lived back in Roanoke, and they were like, oh, he's too young, he's too young. It must just have been the dentist office that was off on that, because yes, I have since brought in all my kids, minus the third one, which she is 7 months now, and I am wondering too about breastfeeding, because I'm still doing that. Is that another question that you get, or how do you guys support mothers that are still trying to do that but have to deal with teeth?
So yes, for breastfeeding, we get a lot of patients that come in with trouble breastfeeding, not able to latch onto the breast, moms not being able to respond by producing enough milk, or breastfeeding is painful for mom. And so what we do is we use a laser in the office, and we release lip or tongue ties that these babies may have. And that's where babycito comes in very useful for us, because thereafter we have to refer to lactation consultants, sometimes pediatricians if they've not, if they're new to the area, then we refer using babycito's referral network.
Okay, so how else do you guys support local families that have little ones?
Yeah, babycito has a whole host of providers in our directory. So like Dr. Gatek said, we have dentists, pediatricians, lactation consultants, sleep consultants, speech pathologists, which also is sometimes connected with lip and tongue tie, especially if children are older who are getting those releases. But everything from doulas all the way through summer camps and everything in between.
Anything special or different offers that you have going on right now? This is probably back to the dentistry.
Yes. Well, we just opened an Arlington location, and we also just launched another part of our business, and it's called Nova Lip and Tongue Tie. So we do the laser lip and tongue ties over there, the procedures over there, plus we also do myofunctional therapy to help strengthen the muscles after they're released.
Okay.
So that's big with us. Those are the new things for us. Plus, for Dental Health Month, for the month of February, we're doing a free electric toothbrush for every patient that comes in through the show or through babycito.
Okay.
So that's another exciting offering.
Okay. I do have to ask about tongue ties really fast. Is that like a trend, or has everybody always just had tongue ties but didn't get them fixed? Versus, because now I feel like you're just constantly hearing about it and everybody's getting that fixed. Is that just me, or is that?
Well, there's more research now, and science is progressing. So I think there's more research into that area. So they're coming up with more studies and more evidence as to why it could be related to speaking, swallowing, breathing, habits, all of that tied together.
Really? Yeah. Well, anyway, very informative. I love just talking with you guys about this. Anything else that you want to say before we head to a close?
No, just I think check us out on our websites, online on social media, at babycito.co, at Merrifield's
Pediatric Dentistry.
And we have that website up on the screen. We also had your special offer listed. Thank you guys so much. We appreciate your time today.
Thank you,
for
Bridget.
having
This was great.
us.